everyone, my name is Bella. For this presentation, I will be talking about CGRP inhibitors and their role in the treatment of migraines. Migraine triggers aren't a direct cause of migraines, but they can increase the risk or even activate the process that leads to an attack. One common trigger is a change in sleep patterns. This could be anything from oversleeping to getting too little sleep, even just going to bed and waking up at different times than usual can trigger them. Certain foods and drinks can also play a role. Some common culprits include alcohol, chocolate, aged cheese, cured meats, products with artificial sweeteners. Hormonal changes are another big factor, and this is hypothesized as to why women are 3 times more likely to have migraines occur than men, due to the different phases of the menstrual cycle, menopause, and also pregnancy. Stress can also be a huge trigger for a lot of people, and sometimes even things such as physical activity in some cases can trigger a migraine. What exactly are migraines? They are a lot more complex than a bad headache. It is a neurological condition that can cause a multitude of symptoms that can affect daily life and make it challenging to do things such as work or hobbies. According to the Migraine Research Foundation, over 39 million Americans suffer from migraines. Women are about 3 times more likely to experience them than men. They are often accompanied with symptoms such as nausea, sensitivity to light and sound, and sometimes even visual disturbances. The pain from the migraine attack can last for a few hours or even a few days. But there's a relatively new treatment that is the first of its kind to actually abort the migraine rather than just masking the symptoms. Prior to the onset of the migraine attack, there is a phase called the prodrome phase. This can be a warning for individuals that a migraine is on its way. These symptoms can start hours or days before the actual attack of the migraine, and it can cause symptoms such as fatigue, mood changes, neck stiffness, food cravings, increased yawning, and even strange symptoms such as constipation, fluid retention, increased urination. To those who experience auras with their migraines, it often occurs about an hour or so before the migraine itself. Not everyone who experiences migraines experiences the aura. The symptoms can be bright spots or flashing lights, seeing shapes or patterns. It can even cause pins and needles in the arms and legs, numbness and weakness in the body and face, difficulty speaking, and it can even cause tunnel vision or take away your vision entirely. The migraine attack is obviously its main phase. It can last anywhere from 4 to 72 hours without treatment. Symptoms can vary quite a bit from person to person. The pain is often one-sided, but it can also affect both sides of the head. After the pain of the migraine goes away, there is a phase called the postdrome phase. This can cause people to experience mental fog, physical exhaustion, mood changes, difficulty concentrating. It's often referred to as the migraine hangover, and it can last from a few hours to up to 48 hours. So what is CGRP and how is it related to migraines? CGRP stands for calcitonin gene-related peptide. It's a protein in the body that helps widen blood vessels and regulate blood pressure. In people who experience migraines, they have too much CGRP being released. And this excess CGRP activates pain signals in the brain, and this leads to migraine symptoms. So the trigeminal nerve is a key player in migraine attacks. This image is showing this process. When the trigeminal nerve is activated, it releases the CGRP. This causes inflammation and widening of the blood vessels in the brain, which can lead to the migraine pain. It works by binding to a CGRP receptor complex, and when it binds, it activates the pain signals. The goal of CGRP inhibitors is to stop or reduce the migraine attack by blocking the excess activity of the CGRP protein. There are two main types, monoclonal antibodies and CGRP receptor antagonists. So the monoclonal antibodies are lab-made proteins, and they are able to target and kind of neutralize the CGRP that is floating about in the bloodstream. The receptor antagonists work by blocking the CGRP from attaching to its receptors, so it kind of takes up a spot where the CGRP would bind to. Although CGRP inhibitors are kind of a groundbreaking treatment for migraines, it has been shown to only work for about 50% of migraine sufferers. Within those 50%, it does work very effectively, and they're still researching as to why the other 50% it does not work for them. So there's two different kinds of CGRP inhibiting medication. Some are given by injection, either intravenously through infusion or subcutaneously under the skin. And then there are several pill forms, such as dissolvable tablets, regular tablets, and nasal sprays.